Okay, I'm going to show you how to do a really simple nerve glide if you're having any groin pain, numbness and tingling, or if you were prescribed this because you're having some issue with your pelvis and pelvic floor. So today we're going to do our iliohypogastric and ilioinguinal nerve glide, and towards the end of the video I'll show you a really simple modification on how to turn it into and include a genitofemoral nerve glide. All nerves that are running through the anterior or front abdominal wall into the groin, down into the pelvis. So what we're going to do is, if I'm working on my right side, and I would like for you to stand with a good base of support so that you don't lose your balance and that you can really kind of control your hip and pelvic position so that's not twisting and moving with your nerve glide. So if I'm working on my right side, what you're going to do is you're going to turn your body, rotate to the right towards the side that we're trying to target. We want the rotation to go as far as you can comfortably go. And then once we get that rotation in, what you're going to do is we're going to do a left side bend. So from this position, it's going to look like I'm dropping my left shoulder down. I'm maintaining that rotation to the right, and then I'm just dropping that left shoulder down to get that left side bend. Once I get into that position, and again, it's just as far as I can comfortably go. We never want the nerve glide to feel like it's really noxious. If it isn't too intense or uncomfortable, just decrease how much you are either rotating or side bending. But you do want to feel a little bit of like some kind of pull or stretch feeling on that right side. You're going to pause, take a deep breath into your belly, and then you'll get out of that position. And for the nerve glide itself, you're going to repeat this multiple times as prescribed. So again, for the right side, I'm going to rotate to the right, and then I'm going to side bend to the left by dropping my left shoulder. Pause, take a deep breath, and then get out of the position. So that is our ilioinguinal and iliohypogastric nerve glide. To make it a genitofemoral nerve glide, all we're going to do, same thing if we're working on the right, is I'm going to get into almost like a hip flexor stretch position by taking that right leg and placing it behind me. I want my torso to stay upright though, so we don't want to take that step back and have a forward lean. So stay up nice and tall. And then now we're going to do the same thing for the ilioinguinal and iliohypogastric nerve by rotating our body to the right and then bringing my left shoulder down for a left side bend. Pause, deep breath. And then I'll get out of that position, but leave my right leg behind. And again, I'm going to repeat that for the number of prescribed times per session that you're doing this. So there we have our traditional nerve glides for anything that may be affecting the groin or maybe even the inner thigh. Okay.